This is the humerus. Firstly, it's divided into three parts: proximal end, the shaft, and the distal end. First, the proximal end. It includes head, neck, and greater and lesser tuberosities. The head, it is slightly less than half a spheroid. The anatomical neck, it is a slight construction directly distal to the head margin. The lesser and the greater tuberosities, the lesser it is anterior and just below the anatomical neck, but the greater tuberosity, it is most lateral part of proximal end of humerus. Now we will pass to the shaft. It is almost cylindrical section, proximally and flat distally. The distal end, it is wide end which articulate with the radius and ulna at the elbow. Also it has lateral process called the capitulum and medial process called the trochlea. The capitulum less than half sphere. Also it articulates with the radial head. The trochlea, it's articulate with the trochlear notch of the ulna. Also it is medial and lateral epicondyles, olecranon, coronoid, and radial fossa. A blunt medial projection on the medial side of the lower end of the humerus. It is subcutaneous and can be felt easily. But the lateral epicondyle, it is lateral angle of the distal end and it does not project beyond the lateral border. Now we will talk about the shoulder. It is the junction between the upper limb and the trunk. It has two bones form the shoulder girdle. Anterior one called the clavicle and the posterior called the scapula. The shoulder attached to the trunk by sternoclavicular joint and many muscles. There is a joint between both shoulder girdle bones called a acromioclavicular joint. The shoulder consists of the scapula and the clavicle. The scapula, it is large, flat, and triangular bone. It is the posterior bone of the shoulder. Also, it has many processes: sponneous, which called also spine, acromial, and coracoid. The spine, it's project from the dorsal surface. Acromion project forward from the lateral end of the spine. The coracoid process project anteriorly near head and hooks slightly laterally forward. The clavicle. The clavicle is the anterior bone of the shoulder girdle. Also, it transmits weight of the limb to the axial skeleton. The clavicle can be divided into lateral third, medial two-third, and the shaft. Now we are going to discuss about the positions in the radiograph of shoulder and humerus. Anterior, posterior of humerus. In the patient position, the patient must stand facing the X-ray tube. Patient is then rotated so that the shoulder of the affected side the arm and the elbow come in contact with the cassette. Lateral view of a humerus is part of the humerus series and is usually taken in a standing position. However, it can be also taken in supine. In the patient position, the patient must stand facing the X-ray tube with the injured side closest to the detector or cassette. Patient is then rotated so that the shoulder of the affected side, the arm and the elbow come in contact with the upright bucky or cassette. The elbow is moved away from the In the radiograph of the shoulder, the patient must be erect or supine position. The erect position is less painful. Then rotate the body 45 degrees toward affected side. If the condition of the patient don't allow him to stand, he can take image either by supine position or sitting.